studio. We're looking at children between the ages of 6 to 16. 10, 12 years from now in this country, we're going to have a lot of those children dropping dead. I'm not trying to scare you, parents, but the sheer junk your children are eating will not lead to healthy blood down the road, and we will see a lot of degenerative, chronic degenerative diseases in this country, and it will burden this administration and anyone that follows it. I'm interested in medical solutions. I'm a naturopathic doctor with a strong science background, as you know, and I'm always looking for proof. I will not put my name to promoting or recommending a natural product unless it's had science behind it. And we've recently introduced a medical procedure in Barbados through Health for Us Clinic, Grisette's main room, where, by the way, our consultations are totally free. It's called Medical Ozone Therapy, and this is not just something that came up yesterday. This has been out there. Traditional medical doctors, not naturopathics like myself, have involved themselves with this modality for years, well over 30, 40 years. In fact, way back in 1966, one of the most memorable Nobel Prize laureates, the winner of the Nobel Prize in Medicine, a guy called Otto Warburg, proved that a lack of oxygen causes cancer. We know that alkalization of the system is important. We know that cancer cannot exist in the blood if it's oxygenated. But guess what? Oxygen is 2 oxygen atoms. Oxygen, as we breathe it, as we know in chemistry, is 2 oxygen atoms. Ozone, this phenomenal radical substance, is 3 oxygen atoms. So it's more fired up, it gets in there, and it does a whole lot of things within human physiology. And I'm not going to paraphrase this, I'm going to read a couple sentences here from the literature explaining exactly what ozone therapy is, and then go back and look at the 3 key points that we're bringing to the table and show folks in this country why they ought to get to Southern Palms Conference Room this Saturday to listen to a totally free seminar, one at 4 o'clock and one at 7 o'clock on Saturday afternoon. Medical ozone therapy is one of the most powerful and versatile therapies known today in medical science. Extensive medical research on ozone therapy has been done primarily in Europe. Through its mechanism of action, ozone has beneficial effects on every part of the human system. Medical science, medical ozone has been used to treat infections, wounds, multiple disease states, and even to disinfect drinking water. It is effective, we're talking ozone now, it is effective as an anti-cancer, antiviral, antibacterial, antifungal agent. And for that, ozone is unsurpassed, mainly because it has no appreciable side effects. So we're talking oxygen, we're talking an activated form, a very aggressive form of oxygen, i.e. the ozone, 3-part molecule of oxygen, which gets into the system, it inactivates bacteria, viruses. Can I say that again? Viruses, fungi, the enhancement of circulatory situations within our bodies, and therefore for cardiovascular issues, concerns, this modality, this procedure is absolutely top-notch in terms of bringing results to folks plagued with those issues. Stimulation of oxygen metabolism, and anyone into biochemistry or understanding physiologic conditions within the human body would understand the importance of that concept. Dissolution of malignant tumors, activation of the immune system, and the formation of hydrogen peroxides. All of those points are key features that are delivered when a person gets ozone therapy. And a lot of people think the strategy, what we are unveiling now, is the situation where we have a person sitting in a steam tube with their head out and oxygen and ozone is being passed over the body. Not so at all. Admiral, I'd like you to look at this image here, and you'll see exactly what it is. This is intravenous, folks. This is intravenous medical ozone therapy. where a cannula is put into the veins, blood comes out, it goes through a filtration process. That blood in a sterile filtration device, similar to kidney dialysis, is then bombarded, that's the word I choose to use, bombarded with ozone. It's then put back into the other arm via cannula again in a perfectly, totally sterile environment. And you now have highly ozonated and oxygenated blood. It's called recirculatory hemoperfusion. That's a scientific word for the process I just described. And when you combine that with two other strategies that I've brought to the table, you have a recipe for knocking out, folks, I'm telling you, for knocking out any disease state within the human body. The other two items that we'll bring to the table would be what I call cellular iodization of the human cells. What is that? That is getting iodine, a pivotal element within human physiology, now known in medical science. Iodine, or deficiency, I should say, of iodine, not only contributes to things like goiter and thyroid problems, that's well established in medical science, but premature births linked to an iodine deficiency, heart disease linked to an iodine deficiency, all cancers linked to an iodine deficiency, heart disease, linked to an iodine deficiency. You don't have to be a rocket scientist, you certainly don't have to be a medical practitioner to understand, and watch this now. I often say on this program, folks, you remember Dr. Stan always says, you cannot ever, ever improve on God. Okay? Now, some of us try to play God because they feel that drugs is the be-all and end-all. I'm saying that we cannot afford to not put ozone, to not put iodine into the body. Why? Because God in His wisdom has placed iodine in every single cell of our bodies. Another important aspect of this three-pronged approach I'm using, which involves, as I said, getting iodine into the bodies, improving or enhancing the human immune system, and then bombardment of the blood within our veins, within our body, with a revolutionary, totally aggressive super cleanser called ozone. Ozonation of the blood will knock out any disease state. The next point I want to spend a minute or so on is the enhancement of the human immune system. We all know that when we have a weakened immune system, yes, you're going to get a cold,